Hi everyone, I'm Dr. Ben Schwartz, and I'd like to talk with you about how the Health Department investigates COVID-19 cases and what we do to limit spread in the community. I'm at the Fairfax County Government Center, and just down the hall from where I am right now, our COVID-19 Contact Investigation Call Center is hard at work. The call center has a team of nurses and epidemiologists who are reaching out to each person who has a positive test for COVID-19, the novel coronavirus. Once they contact the person who is infected, they provide information on the steps to take to avoid infecting others. Advice includes staying home and avoiding contact with others in the household and having a separate bedroom and bathroom if possible. Call center staff also provide instructions on how to identify others who they had been in contact with and how to talk with them about quarantine. What quarantine means is that those exposed people also should stay home and away from others for a 14-day period, the time during which they might become ill. This is important. By staying home and away from others, they can't spread disease if they have been infected. This is what we do if we know someone was infected by COVID-19 based on having a positive test. But what if they have an illness that looks like COVID-19 but never got tested? What happens then? That's where we need your support. We all know the problems with getting coronavirus tests. Test kits may not be available. Doctors may decide that a test isn't needed, or perhaps someone doesn't have a doctor at all. In all these cases, someone may have COVID-19 infection and not get a positive test. In fact, the University of Virginia estimates that for each person who tests positive, there are 6 others who have COVID-19 and are not tested, but who still have the disease. So if our call center reaches everyone who has a positive test, what happens to these other 6 out of 7 people who are infected but not tested? We are asking those who have been diagnosed with COVID-19 by their doctor whether or not they have had a test, and people who haven't seen a doctor but are sick with fever, chills, muscle aches, cough, or sore throat to do the following. First, stay at home for at least 7 days and stay away from others at home as much as possible. Second, identify your contacts. This is everyone who is within 6 feet of you for 10 or more minutes while you were sick or during the 2 days before your illness began. Next, reach out to all of these people. Tell them you are sick with symptoms of COVID-19 and that they may have been exposed. Then ask them to self-quarantine, that is, to stay home for 14 days and avoid close contact with others. If they get COVID-19 symptoms during that 14-day period, they should talk to their close contacts and then have that same conversation. Every household in the Fairfax Health District was mailed a toolkit with these details. You can also find it online at www.fairfaxcounty.gov/COVID-19. Contact tracing is a cornerstone of public health work to stop the spread of many infectious diseases, such as measles, tuberculosis, and meningitis. It works. By taking the simple steps of isolating yourself if you develop coronavirus-like illness and talking to your contacts about quarantine, you can amplify the work of the health department and have an important impact on controlling disease in our community. We all long to get back to normal life, and I can't speculate on when that will happen. But what I can tell you with certainty is that if we all stay persistent, we can and will get this disease under control. We do have the power to slow or stop the spread of COVID-19 if we do the following 3 things. First, if you are sick, isolate yourself. And talk with your close contacts and ask them to quarantine themselves. Second, stay home if possible. And if you do go out, make sure you socially distance and consider using a face covering. And third, wash your hands frequently and don't touch your eyes, your nose, or your mouth, which could allow the infection to get into your body. On behalf of everyone in the Fairfax Health District's Contact Investigation Call Center, as well as our entire health department, thank you for supporting the fight against COVID-19. Be well and stay safe.